Good morning, everyone. Welcome to Heartcare Foundation of India virtual program. We are here for the inauguration ceremony of online nurses training program on home-based nurse-led care on COVID-19 illness in association with School of Nursing Sciences and Allied Healthcare and endorsed by Indraprastha Global University. Heartcare Foundation of India is a national NGO. Um, Heartcare Foundation of India is a national NGO registered under the National Charitable Trust in 1986, working on the uh, uh, HCFI is actively working on creating a mass health awareness and providing solutions to all walk of life, incorporating all pathies of low-cost entertainment module under one roof. It is the only NGO to be honored by Government of India for national stamps on 3 occasions and one cancellation stamp. HCFI under CPR 10 program has received three Limca Book of World three Limca Book of Records holder. Organization is chaired by Dr. K. Aggarwal, Padma Shri, past National President, Indian Medical Association, President for SIMAO, and Editors-in-Chief, Indian Journal of Clinical Practices. I would now like to invite Dr. K. Aggarwal for the inauguration speech.
Thank you, Saurabh and thank you, Dr. Mahesh Verma, our chief guest of the day, the function, and Dr. Syed Hussain ji, the Padma Shri awardee and the Vice Chancellor of Jamia University, Professor Amarjeet Kaur ji, Dr. Kalra, Dr. Manju Chogani, and our own colleagues, Dr. Anil Kumar is here, Priyasi, Shri Anil Ahuja ji, and others. Thank you, Dr. Mahesh Verma, the Vice Chancellor of Guru Gobind Singh Indraprastha University, a former President of Dental Council of India, a former head of Maulana Azad Dental College, a former head who conceptualized the idea of dental mela in India. Thank you for accepting to be the chief guest. Dr. Sunila Garg, my senior, my teacher, my mentor in my medical college, and a public health expert, he is also here with us. So the purpose of, for the last 6 months, we have been working on creating awareness on COVID-19 fear, how to take the fear out. And two new things emerged. Number one, the need for telemedicine that ultimately became a law. Telemedicine guidelines have come. Now it has become a reality. The second thing which has now become a reality is home care. Now, future is going to be of home care, less of hospital admissions. People will now get admitted in the home. Their consultations will be online. Nurses, healthcare workers, and doctors will become an important part of home care. Maybe today, doctors are managing through nurses. Tomorrow, doctors through nurses and nurses through paramedics may be able to take care of a person at home. As on today, we don't have a concept of a nurse practitioner, but in the government sector, we know nurses can be assigned any powers under Drug and Cosmetic Act Section 23. They can be given powers to give even first aid treatment. We also know that all nurses are empowered to take care of an emergency where they have a protection under the Indian Penal Code under the good faith section. But today the time has come to formally have people for home care. There are commercial groups who are doing home care by people, but we don't have independent nurses, doctors who can be available for home care, because telemedicine now will increase its job. One, today we can say with authority that in COVID, mortality is an exception, not the rule. And recovery is the rule and not the exception. when COVID came, it came with 100% admissions till the person is COVID negative. Then came no, after 9 days, you can go back to home for a home care. Then now came back is after 5 days or 4 days, you can go home for a home care. And now we are talking about home care for people unless you need an oxygen. And I am 100% sure another few weeks you will find a policy change that unless you need a high flow oxygen, home care is sufficient. When I say home care, high flow oxygen, I mean that you are requiring a high flow nasal cannula. But if your requirement is 5 to 10 liters, and if you have a concentrator available, yes, home care will become the routine and then the rule with that. So we know that we need home care professionals. These home care professionals can be doctors, it can be nurses, it can be paramedics, it can be technicians who can provide a home care with that. Up till now, private nurses were available in the city. You can hire them for 12 hours duty. And they also, but they were not professionally trained as a home care nursing. Now here, Dr. Manju Chogani came with an idea when we are having regular meetings that why not come out with a university recognized course, which will be a 18 hours course, a 3 days course, where we can offer them theoretical classes, and then we can give them a practical training. The practical training would involve that we are having regularly patients classes in the morning, 8 to 9 o'clock, where 70 to 80 patients on a daily basis participate. These nursing can participate as a practical training, learn, talk to them, and learn about the patient care, even if they have not been exposed to a COVID ward. They will be able to. As on today, we are talking about corona care, but ultimately home care will be everywhere. Well, whichever condition you have, home care will come. Say, for example, after heart attack, after 4 days, you can go back to a home care. So the idea was that apart from people who are practicing as a professional groups, let's have individuals who can be available as a home care provider. When Dr. Manju Chogani she floated the idea, I handed it over to Professor Kalra, the expert in Heart Care Foundation of India on quality and safety, to build up a program. And today, Dr. Kalra has initiated this program. Then we requested Dr. Mahesh Verma and Dr. Manju Chogani that if 2 universities can bless us. Dr. Manju Chogani, she basically belongs to the Jamia Hamdard University. And then we approached Dr. Mahesh Verma, and he happily, under the Disaster Management Act, approved, endorsed this particular program, so that now this program becomes an official program where we will have theory, we will have practical, and our intention is to train 1,000 nurses in the first 6 months. So today we have a small batch because it's a part of inauguration, but this program will be available all across the country, a structured program which will be given by a certificate to everybody. So I thank Dr. Kalra, Dr. Manju for initiating, taking a lead and building it up and making it a reality in time. And I'm very thankful to Dr. Mahesh Verma and Madam Anuradha ji Madam Usha Pradhan is here, and Professor Amarjit, I saw her here, and Professor Amarjit to be here. I hand it over to Saurabh. Thank you very much.
Thank you, sir. And before I call the another speaker, I would like to thank you for Doctors' Day. Today is a Doctors' Day, and we would like to salute to all doctors for their unconditional support to all the patients for on this day of COVID when we really need you. I would now like to invite Professor Dr. Manju Chogani. She is a Dean for School of Nursing Sciences, Allied Health, Jamia Hamdard.
Good morning. Shall I start?
Yes, ma'am. Please give the program overview.
Okay.
Thank you.
Thank you so much. Good morning, everyone. Honorable Professor Mahesh Verma ji, Vice Chancellor, IP University, Professor Saeed Ehtesham Hasnain, Vice Chancellor Jamia Hamdard, Dr. K.K. Aggarwal, President Heartcare Foundation of India, Dr. K.K. Kalra, Director, Heartcare Foundation and former CEO of NABH, and Professor Amarjeet Kaur, Director, University Center for Disaster Management, IP University, and my colleague Priyasi Chauhan. It gives me an immense pleasure to be part of today's program, and I must admit here that the idea was floated, but to convert it into reality, it's Dr. K.K. Aggarwal and Dr. Kalra and Vandana as well, who made it as a reality. So thank you so much for that. And happy Doctors' Day once again to everyone. And we feel blessed to have God-gifted personalities. I would definitely say that they are God-gifted personalities like Dr. Mahesh Verma, Dr. Saeed Ehtesham Hasnain, Dr. K.K. Aggarwal. All three of them are Padma Shris. And I think they are contributing immensely to the society. They are serving the society with their so much of their work, guidance, motivation, encouragement, plan, implementation, whatnot. So thank you so much for doing this. You are really a God gift to us, and we feel blessed to have you all with us. And today is the launch of online training program on home-based nurse-led care for COVID-19-like illnesses in collaboration with Heartcare Foundation of India and Jamia Hamdard, and endorsed by IP University. And I feel that this is a lifetime opportunity for nurses. It is, of course, an unprecedented time when we are facing a lot of challenges, all kinds of challenges and problems. But at the same time, I would say that this is a lifetime opportunity for nurses to play their part in best possible way and show their worth by words, not by words, but by their work. And I think this is the beginning that, as Dr. Aggarwal said, that it has become a reality that need of telemedicine and home-based care. So nurses constitute the largest workforce in any healthcare setting. So their role is very, very important during this pandemic. And the training program is of 3 days duration with provision of certificate to trainees, with the objective to prepare nurses to provide home-based care to COVID patients confidently and efficiently. As Dr. Aggarwal said that, it is now an official training program, and which involves both theory and practical. And I must say here also that it is being seen with the lens of NABH. All presentations and everything related to the program, structure of this program, is being seen by NABH lens. So you can imagine the quality of the content which we are going to deliver during this program. And with my request, and I'm so obliged and thankful to Dr. Aggarwal that he has agreed that they can even get the practical experience. These trainees will get opportunity to have that, like we used to learn in OPDs when doctors were treating patients, and we could see and learn a lot of things. So that provision is also there for these trainees, which they will come to know today, because we have not revealed this yet, but they will definitely feel happy on this. And the program is a mix of lectures, videos, simulations, scenarios, case scenarios, and is very well structured by course directors. And all registered nurses and final year nursing students are eligible to undertake this training, and there will be exam after 24 hours of completion of the course. And 2 attempts will be allowed to get the score of 70% to get the certification. And in this program, we have tried to cover most of the topics where they will feel confident and what they are going to utilize when providing home-based care, like management strategies, infection prevention control, biomedical waste management, home isolation and quarantine management, oxygen therapy, medication safety, supportive therapy, psychological support, first aid management, communication and documentation, which is very, very important, training and education to public and healthcare workers. A session on that also is there. And finally, we'll end with the myths and fake news busters, which will be taken by none other than Dr. K.K. Aggarwal. So this is the content, main content of the program. And the resource persons also, I would like to say here, are all renowned people from different AIMS Rishikesh, AIMS Delhi, and then Maulana Azad Medical, MEMC, of course, Jamia Hamdard, Heart Care Foundation of India. So it is a great mix of all renowned people and stalwarts of the profession who will be delivering their like knowledge and their expertise during this training program, 3 days. Some of the trainees are very, very knowledgeable people who are going to attend this training program. But I would say that it is important to have the structured training program with certification, which makes a difference. Like a license, when we get for driving a car, we might be knowing how to drive a car, but once we get license, we feel confident to drive. So same is the purpose here also. And with these words, I want to thank two persons here who have worked day and night, apart from others who, of course, there are a lot of people. But Vandana Rawat, manager, Heart Care Foundation of India, and Priyasi Chauhan, who is working in School of Nursing Sciences and Allied Health. They have worked on ground throughout these days. And since Dr. Aggarwal gave timeline, not deadline, timeline first, and we were committed to that. And I'm happy that we could do it today, this launch. Thank you so much. Thank you, sir.
Thank you, ma'am, for a wonderful speech. And yes, it is a need of hour today. What best we can do today when we need the front warriors. This is one of the best course we can ever help the society and train more people so that they can come forward and help the society. So yes, it is a need of art. I would now like to invite Dr. K.K. Kalra. Dr. K.K. Kalra is currently on the board of Heart Care Foundation of India and heading the safety and he's Dr. Kalra is the former CEO for NABH. Can I please invite Dr. Kalra to explain the role of nursing and training session?
Before we start, something very important we are missed. I request Ms. Sahej is here. We have to formally inaugurate the session. Please invite Sahej for a Saraswati Vandana. After that, we will do the formal inauguration of the function. Then we'll start further. Sahej, she is there. Can you listen to me?
Yes, sir, sure. I'm listening to you.
Yeah, please, I request you for a Saraswati Vandana.
Thank you so much, sir. And thank you so much, all the respected members presenting here. Myself, Sahej, from BSc Nursing 3rd year, Prem Institute of Medical Sciences. Sir, may I start?
Yes, please.
Yeah, please.
Okay. He Sharade Ma, He Sharade Ma, Ajnanata se hame tar de Ma. He Sharade Ma, He Sharade Ma, अज्ञानता से हमें तार दे माँ तू श्वेत वर्णी कमल पे विराजे हाथों में वीणा मुकुट सर पे साजे मन से हमारे मिटा के अंधेरे हमको उजालों का संसार दे माँ हे शारदे माँ हे शारदे माँ अज्ञानता से हमें तार दे माँ, हे शारदे माँ, हे शारदे माँ, अज्ञानता से हमें तार दे माँ। तू स्वर की देवी, ये संगीत तुझसे, हर शब्द तेरा है, हर गीत तुझसे। तू स्वर की देवी है, संगीत तुझसे, हर शब्द तेरा है, हर गीत तुझसे। हम हैं अकेले, हम हैं अधूरे, तेरी शरण में हमें प्यार दे माँ, हे शारदे माँ, हे शारदे माँ, अज्ञानता से हमें तार दे माँ। मुनियों ने समझी है, गुणियों ने जानी, वेदों की भाषा, पुराणों की वाणी। हम भी तो समझे, हम भी तो जाने, विद्या का हमको भी अधिकार दे माँ, हे शारदे माँ, हे शारदे माँ, अज्ञानता से हमें तार दे माँ।
I will request Dr. K.K. Aggarwal to enlighten us with the importance of Saraswati Vandana. All such programs in India is a customary to start with, especially the educative programs, to start with the Saraswati Vandana. That what Sahej has done. Now I will request Dr. K.K. Aggarwal. Is there our president?
When we talk about Saraswati Vandana, Saraswati is Ma, not father. So the teacher has to be like a mother. The role of a mother is that she looks after the weakest child with the same love as the strongest child. So therefore, if you go back to the basics, that's the role of a mother, and that's the role of a teacher, and that's what Saraswati basically represents. Saraswati is wearing a white sari. White means purity, truthfulness. Yellow, which is the sari of Krishna, means vigor. So therefore, Saraswati basically talks about teaching the truthfulness. She has 4 hands. In one hand, she has a rosary, which indicates Ratna theek hai, but Ratna is not that important. That represents repeatedly, learning repeatedly. Then she has a small Vedic book in her hand, which indicates that you read, read, and read. But she has a big veena in 2 hands, the role of skill. Suno, samjho, jano, karo. That rosary means repeatedly listening, reading is not sufficient without a skill. So therefore, that's what Professor Manju said. The 3 days program will be learning, but that learning without a practical has no value. Without a practical has no value. When Lord Rama was 16 years of age, when he asked his father that I want to go for an internship, and after internship, he went into a dispassion. He says, whatever I've learned practically is something different. So therefore, after 1 year of practical, he did a post-graduation in Yoga Vashishta. Then only he realized what to know and what not to do. So similarly, now Saraswati is also sitting on either lotus or a swan. Lotus means detached attachment. That means every nurse has to be attached to the patient till that patient is her patient or his patient. After that, we are supposed to be detached. Absolutely. It's like an airline. After the passenger goes away, we are detached because the next patient has come to us. And that is indicated by the lotus, because on lotus, a drop of water comes, it never stays on the leaf of a lotus. Or she's sitting on a swan. If you give swan a water with the milk, he will drink the milk and take the water out of it. That is called vivek, the power of discrimination between good and bad. A teacher's job is not to teach anything which is unrelated to the subject, only teach which is truthfulness. And that Ma Saraswati basically we celebrate as the first, whenever we start any class, we follow these principles of Saraswati, the principles of students and principles of the teacher. Thank you, Dr. Kalra.
Thank you, sir. Now I will request you to invite our dignitaries and chief guests for formal inauguration by a candle or a diya lighting.
So, Dr. Mahesh, you will have to do the acting. I will do the practical.
And another chief guest, he is physically could not be make it convenient to come here to join the meeting. He has sent an audio message. Saurabh will be playing when in the further time. Yeah, Dr. Verma.
So we are heading for the inauguration, formal inauguration with the lamp lighting. This is, I believe, one of the most creative lamp lighting. I would like to, thank Dr. KK and Dr. Kalra for this idea, and we were wondering how will that happen. I think it is very nice. So this is one of the. I love to see Dr. Mahesh Verma is holding the.
So bring him in the center screen, please. He should be in the person talking. Dr. Mahesh Verma, please come in the center.
So we have Dr. KK Aggarwal, Dr. Manju, Dr. Mahesh Verma,
Presi.
and Dr. Amarjeet ji, I can see.
And Presi.
And Presi ji. So this is one of the very creative way of inaugurating, and thank you very much from everyone.
Please raise the candles. Yeah. Everyone, all dignitaries. Yeah, please. Thank you.
Before I can invite for next speaker, I would like to also inform that we have, so NGO is one of the very important organizations who play the role for all these time when we are in problem. We have NGO, we have a lot of NGOs who are joining us right now at this session, and they will be here with us for some time, and then there will be a session on first aid which will be taken by us for them.
So now I will start.
Yes.
So now I will start my formal session. First of all, I want to thank our patron and our main person, President Healthcare Foundation of India and Padma Shri Awardee Dr. KK Aggarwal for conceptualizing this program. And also thanks our chief guest, Dr. Professor Mahesh Verma, for accepting to our invitation in such a short notice and endorsing this training program under the IP University. Also thanks Dr. Amarjeet Kaur, the Director of Disaster Management Cell, IP University, for encouragement and our kind presence today in the function. Also, I thankful to Dr. Manju. Without her, this program would not have been possible. And she's made her all efforts for the success of this program. And most probably by her efforts, the Nursing Council of India is also going to give the credit hours to this program. I am also thankful to Presi and Vandana, Ritu, Saurabh, and our all team members who have been working very hard for this, and really is a good initiative at the level of Healthcare Foundation, IP University, and College of Nursing Hamdard, Jamia Hamdard. Now coming to my talk, basically we know the nursing professionals have a major role in collaborative care of individuals of all ages, families, groups, and communities, sick or well, and in all settings. Nursing includes the promotion of health, prevention of illness, and the care of the ill, disabled, and dynamic people. Advocacy, promotion of a safe environment, research, participation in shaping the health policy, and in patient and health systems management, and education are also the key nursing roles. Nursing is a great force and a great value to the society. We need to empower the nursing professionals. Throughout the treatment process, the nurse follows the progress of the patient and acts accordingly with the patient's best interest in mind, it's important that they are able to think critically when assessing patient signs and identifying potential problems so that they can make the appropriate recommendations and action in time. Nurses are the most familiar with the individual patient situation as they monitor their signs and symptoms on an ongoing basis and should collaborate with other members of the medical team to promote the best patient health outcomes. Patient educational support, their role. Nurses are also responsible for ensuring that patients are able to understand their health illnesses, medications, treatments, and best of their ability. This is of essence when patients are discharged from the hospital and they will need to take control of their own treatment. In redesigning the healthcare systems, nurses are assuming expanded role for the broad range of patients in ambulatory settings and community-based care. The roles involve new responsibilities for population health, care coordination, and interpersonal collaborations. The healthcare system is undergoing a rapid changes that put the new emphasis on population health as well as quality of care and value of the services delivered. These emerging and expanding role for registered nurses will require application of nursing skills in a new way, as well as development of new skills and continuous learning health systems. After these kind of a training session, a nurse will be in a better position in the role of a caregiver, as a provider of holistic care, as a decision maker, as a communicator, as a counselor, as a manager of care, as a patient advocate, and as a teacher. The areas for nursing development are, some of them I will enumerate: the nurse-led clinics, the collaborative care, non-pharmacological interventions, evolving role of nurse in a medicine management, optimal treatment of comorbidities versus risk of polypharmacy, the review of the psychotropics, the support for safe, effective, and appropriate prescribing, de-description of antipsychotics, and reporting of adverse events, mental health and aging, and infection control. Nowadays, infection control is a very important area. The hospital-acquired infections are the real patient safety concern, and they are they are very much enormous in our country, in the developing countries. The amount of hospital-associated infections we get is really alarming, and nurses have a very big role to play in preventing and control of these hospital-acquired infections, and especially the nurse practitioner. All over the world, developed countries, they have a nurse practitioner. Even in India, if we see the health ministry website, they have started a nurse practitioner course for working as a, you can say, assistant to a doctor, especially in the far-flung areas, peripheral areas. I wish success for this program. I think we need to empower our nursing profession in our country. Thank you once again for all the dignitaries who are present here for giving their time and presence here. Thank you. Over to Saurabh.
For explaining the role of nursing. Meanwhile, I would just, before I invite the next speaker, I would just inform the NGOs that we are launching a course for nursing, which will help the front warriors to fight this pandemic virus, and we would take our sessions going forward. I would now like to invite Professor Amarjeet Kaur for explaining the role of certification and training for skill development program. Can you please unmute yourself, ma'am? Yes, ma'am.
Hello. Am I audible?
Yes, you are.
Good morning, everybody. Honorable Vice Chancellor of Guru Gobind Singh Indraprastha University, Padam Shri Shri Mahesh Verma ji, President of Heart Care Foundation, Padam Shri K.K. Aggarwal ji, Vice Chancellor of Jamia Hamdard University, Padam Shri Dr. Hasnan ji, Dr. Kalra, Dr. Anil Kumar, and Professor Manju. I am very glad that under dynamic leadership of our Honorable Vice Chancellor, Shri Mahesh Verma ji, Center for Disaster Management of Guru Gobind Singh Indraprastha University, which has trained more than 100 doctors of central and state government, is now part of the training program of the most important component of the healthcare system, that is our nursing staff for home care. In the present scenario, such type of the training program is very important and very relevant, keeping in view the present pandemic situation of COVID-19. I'm sure this training program will provide the participants with core competency to prepare them for clinical practice in a safe, competent, and confident manner. This course will provide them their previous experience with an update on latest technology and current management of the medical condition. I'm sure after completion of this course, participants will be able to identify the professional role, responsibilities, and clinical judgment required in current scenario. I must congratulate Heart Care Foundation and especially Dr. K.K. Aggarwal for such an innovative programs, which is really need of the hour. I thank all the participants also, and I'm so glad that this is our first program with the Heart Care Foundation, and as recently discussed, we will have more such type of the programs which will be very beneficial to the society. I must again thanks the Heart Care Foundation as well as Jamia Hamdard University for giving the Guru Gobind Singh Indraprastha University this opportunity to be part of this program. Thank you so much. Namaskar.
Thank you, ma'am. Professor Amarjit Kaur was the director for University of Central for Disaster Management Studies in Guru Gobind Singh University. Now I would like to invite our next chief guest for the evening, Professor Syed Mr. Hussain. We don't have, he's not physically present, but he has sent us the vote of thanks on the audio which Ritu will play. Sir is the Vice Chancellor for Jamia Hamdard University, a reputed university ranked first under NIRF. He has been awarded by President of Germany equivalent to India Bharat Ratna, the highest civilian award. He's a Padma Shri awardee and received Germany's highest civilian award, the Order of Merit, from President of Germany equivalent to India Bharat Ratna award, and the only Indian so far, one of the very few persons globally. The prestigious American Academy of Microbiology, USA, elected him as a fellow. He was recently been conferred as an ICMR B.R. Ambedkar Award, the highest award for excellence of biomedical research. Can I please invite Ritu to play the audio?
Verma, Padma Shri, Vice Chancellor, IP University, President of the Heart Care Foundation of India, Dr. K.K. Aggarwal, Dr. K.K. Kalra, Director, Heart Care Foundation of India, Professor Amarjit Kaur, Director, University Center for Disaster Management Studies, Professor Manju Chugani, dear participants, Namaskar, Assalamu Alaikum, and very good morning. Welcome to Jamia Hamdard, an institution recently recommended by the MHRD as an institution of eminence, the 5th highest ranking private institution in the country, private university in the country. I'm very happy to welcome you to this very first Heart Care Foundation of India and the School of Nursing Sciences and Allied Health joint program on online nurses training, more of a home-based nurse-led care for COVID-19 and such illnesses. Today, we are witnessing the worst pandemic in the last 100 years. All countries of the world have been affected. Not only it has affected from the health perspective and well-being perspective, but it has also caused a lot of damage economically. Globally today, we have more than 10 million cases and about 500,000 deaths, which roughly accounts for 0.5% mortality. Today, although this virus, SARS coronavirus 2, originated from China, and the disease first afflicted China, but today the worst hit country is the United States of America, with 40,000 cases per day, and you'll be surprised to know that 80% of all cases have been in the last 2 weeks. And in fact, in a recent briefing to the senators in the US, Mr. Tony Fauci of the NIH, he mentions that if the surge of the virus and the spread of the disease is not contained, US will soon get 100,000 cases per day. This is a mind-boggling cases, and we don't know where this will lead to. Coming back to India itself, we have more than 5.6 lakh cases and with about 2% mortality. In fact, India is the 4th largest hit country after US, Brazil, and Russia. Part of this has to do, and we all have to worry, with the unlockdown. The prestigious journal Nature recently reported, based on a study done in Italy, that 42.5% of all cases had no symptoms. And it is these non-symptomatic, so-called healthy population that is a major spreader of COVID-19. And that is where we are all worried about the impact of this lack of sincerity, lack of seriousness by people at large. We have to ensure that we follow the norms. We have to live with the virus for months together. This is my understanding based on whatever little I know working with this coronavirus, SARS coronavirus 2. As if COVID-19 is not enough and not causing enough damage to the world population, to the world family, a new swine flu virus known as G4 in pigs has just been described in the prestigious journal Nature, and it is predicted that this could be potentially the next big pandemic. So how do we control ourselves and stay free from COVID-19? The best way is to maintain physical distance. Physical distance of about 2 meters is what is today prescribed, and wearing a mask it should be made compulsory. As long as we maintain these two essential and maintain the hygiene, wash our hands, avoid doing social calls, we can be hopeful that we will not be getting COVID-19. if we do get COVID-19, let me tell you, there are some cures, but nonetheless, if we are hoping that there will be a vaccine coming very soon, first and foremost, I must tell you, based on little work that we have done, the virus is mutating as a function of geography. A vaccine made based on the target sequences of the virus isolated from the US, in all likelihood, may not work outside the US, because outside the US we have a different virus. In India, for example, we have a very different virus, which is having a very different kind of mutation. The virus is the same, but then the mutations are very different. I think I have pinned a lot of hopes, and I would like to pin a lot of hopes on the vaccine for which the DCGI has given permission to the Bharat Biotech India Limited in Hyderabad, a company headed by Dr. Krishna Ella, where they are now going to start human trials, phase 1, phase 2 trials. Permission has been given, and this is an inactivated vaccine, so it will be immaterial whether you have mutations or not mutations. And that is where I think my feeling is that success may be achieved. The new drugs that people are talking about, the new antivirals that we are talking about, are other hopes of securing ourselves against the virus. It is with this background that I really want to congratulate the colleagues at the School of Nursing Sciences and Allied Health at the Jamia Hamdard for having taken this opportunity to deal with an unprecedented situation. And we all know the role nurses play in our well-being and health care. Dr. Professor Manju Chugani and her colleagues have come up with an innovative idea of home-based nurse-led care program for COVID-like illnesses. Nurses undergoing this program will be able to serve the people who are required to be well supported for fast healing and recovery. This 3-day course is the first online practical-based training program for nurses in India. And we have set a trend. I'm sure other nursing schools will also follow soon. And this will primarily focus on the nurses' capacity to serve at home as if they're serving in the hospital. In fact, today, many of us would not like to go to a hospital for the fear of contracting COVID-19. Elective surgeries are not being allowed, rightly so. So to train the nurses in providing essential care to COVID-19 like illness in patients and their family is a great effort, is a great initiative. The nurses will get more like an internship kind of experience during this training, where they will also have an opportunity to get online clinical experience of treatment of patients, which Dr. K.K. Aggarwal, the President, Padma Shri Dr. K.K. Aggarwal, the President of the Heart Care Foundation of India, does every day, starting at 8 in the morning. Another unique part of this course is, besides being an online certificate course, the nurses will get credit hours from the Delhi Nursing Council, again a first of its kind. And this course will broadly cover management strategies, IPN control, home management, oxygen therapy, supportive therapy, and also try to break the myths that surround COVID-19. And we do hope, end of the day, nurses, end of the training program, nurses undergoing this program will be able to serve the people who are required to be well supported for fast healing and recovery. Once again, I congratulate the Heart Care Foundation of India, Padma Shri Dr. K.K. Aggarwal, the IP University, Padma Shri Professor Mahesh Verma, Dr. K.K. Kalra, and all the participants and my colleagues from the Rufaidah College of Nursing and the School of Nursing Sciences and Allied Health for having thought about this program. I'm extremely sorry, due to technical reasons, I'm unable to be with you today, although I had planned, and it was only at the last minute I had to withdraw. My best wishes for a very successful 3-day online training course, the first of its kind for nurses in India. Jai Hind. Chief guest.
Jai Hind, sir. And yes, rightly said, social distancing is one of the major factors today, which will help people to stay away from the virus. And yes, Heart Care Foundation India is always known for first ever. So this is the first ever course which we have launched, and with your blessings, it should be successful. Now I invite our next speaker and the chief guest of the day, Professor Dr. Mahesh Verma, Padma Shri Awardee, Dr. B.C. Rai Awardee, and the Vice Chancellor for Guru Gobind Singh Indraprastha University. Okay, Dr. Mahesh Verma, please, can I please invite you to speak?
Thank you, Saurabh. Janab Professor S.C. Hasnain Sahab, Vice Chancellor, Jamia Hamdard University, my dear colleague, Dr. K.K. Aggarwal, President, Heart Care Foundation of India, another colleague, Dr. K.K. Kalra, Director, Heart Care Foundation of India, another colleague, Dr. Banju Chugani, Dean, School of Nursing and Allied Health Sciences, Jamia Hamdard, another very, very dear colleague, Professor Amarjeet Kaur, very dynamic director of our Center for Disaster Management Studies of IB University. And I see a lot of known Dr. Sunila Garg, Dr. Anil Kumar, Dr. Saurav Aggarwal. I also see Mr. Uday Manna here from All India Radio, who's been covering a lot of our events, and so many of other known faces here. Dear Priyasi, Vandana, all the team of Heart Care Foundation of India, as well as from Jamia Hamdard. Congratulations actually, to Dr. K.K. Aggarwal, and altogether Heart Care Foundation, Jamia Hamdard, and IPU, this trio coming together and organizing this online training for home care for nursing. I always appreciate Dr. K.K. Aggarwal for being very unconventional, always out of box thinking, and always responding to the needs of public, society, profession at large. I'm in fact, I'm one of his great admirers, because we all love to say, and but when it comes to doing, somehow we take a back seat. And in fact, a lot of my predecessor speakers have spoken so much about role of nursing and COVID and things like that, but yet I'm here to cheer you up. Some of our nursing officials here, and dear nursing officers, I feel that they are the foundation of any hospital. Like, you cannot build a house without a foundation. You cannot build a hospital without a strong nursing officer. So you must have a solid foundation if you are going to have a strong superstructure. और कहते हैं कि नींव के पत्थर कभी दिखते नहीं हैं. So ये nursing जो है, although doctors are in front line, but these actually the real strength of a healthcare comes from nursing officers. And as Professor Hasnain just now said, that everybody's running out of hospital, and here are our bunch of our nursing officers who are running in and to offer help. where others are actually trying to run out. So I feel that historically we all know that the nurses, they play a very crucial role in a healthcare system. And, it's said that they are the, patient's best advocate and who can even protect doctors from making potential mistakes. There are some things that comes with training, but there are also deeper wisdom which comes with instinct and experience. So a nurse's gut experience or gut instinct is their deeply grounded knowledge base developed in practice, because they see day in and day out. That's how they develop that deep wisdom and deep instincts. Their intuition is valid and worthwhile path to assist accurate decision making. So it's not doctor alone. I think it's a conjoint effort of doctor and a nurse. And it's कहते हैं कि जब मर्ज जब डॉक्टर से ना ठीक हो तो नर्स को अपना हाथ दिखाया करो. ये भी एक कहावत है. I don't know इसमें कितनी सच्चाई है, but ये भी एक ऐसी दार्शनिक स्थिति है. You also know that nurses are strong enough to tolerate anything, going home in tears, feeling like failure, saving the thankless patients, because patients are not all the time, or not every time, have gratitude to you, and coping with overbearing administration. All the administration, hospital administration. I've been part of the hospital. We're all hounding them all the time, but they are still soft enough to understand anyone and everything. Secondly, nurses are patients' best friends, because they are the patient's voice, they are patient's life, pain, suffering, and healing. In fact, I feel nurses are like co-partners in patients' suffering. And, day in, day out, they treat patients, and imagine how much suffering they have undergone, because each and every patient suffering, they also endure simultaneously. Nurses are the ones who witness our elation, our struggle, our recovery, our misery, and also our grief. Nurses take care of physical health as well as mental health. I think somebody did mention, Professor Manju Chugani did say about it, that it's not physically which is agonizing, but they also endure the mental health of all of us. It's not only the primary patient who depends on the nurse, but also the family, caregiver, and the visitors. And it's said that in every ward, there is one nurse who can light up the gloomiest of the days. There will be somebody, like a nightingale nurse, that every ward there is somebody who can really light up the whole environment. And especially we are, as everybody said, that we are passing through a very gloomy phase of our times. COVID-19, there must have been times, especially for nurses, when you've had to go home and explain to your kids why you are late, why you're not able to celebrate their birthdays, or even explain to your elderly family members that why you can't eat at the same table as them, because must be difficult. I know it's all healthcare workers find so difficult to drink water, eat, or a snack with their PPE kits. You see, Dr. K.K. Aggarwal, in solidarity, he himself has come on a PPE kit today. That is the spirit, because he's not only, he's in his room, but in order to show that solidarity with our healthcare professionals, healthcare givers, and as somebody said, it's a doctor's day. And I have heard Dr. K.K. Aggarwal saying that doctor is a term which is all inclusive. And I think it also reflects the nursing staff, all the healthcare workers. So it is not only doctors, but I think it's also a nursing day. It's a very important day also, because something very unconventional, online training for a need-based requirement is started today. Collectively with the universities and with Harkett Foundation. So it is really very heartening. It's also true that every nurse was drawn to nursing because of the desire to care, to serve, to help. Traditionally, we know that when they join the profession, we know that because they get attracted. And also these days, I mean, I don't want to shirk from saying that nurses are paid very well in government offices, and it's a big attraction that not only you get opportunity to serve the mankind, but you also compensated very well financially. Doctors prescribe medicine and treatments, but the nurses, it is the nurse who dispenses comfort, who dispenses compassion and caring without even prescription. They have no prescription. So how to give that comfort and how to give that compassion and comfort to the patient. You know, they, of course, doctor has given the prescription, but all those things which are non-tangible, which is not intangible, actually are shared by the nurses. You know, they say that it's better to light a single candle than to curse the darkness. And that's what doctors do, the nurses do. Nurses in healthcare also must practice self-care. You know, we know that they are at such a receiving end, and to be able to nurture the bodies, mind, and spirits of their patient, they must first nurture their own, because they look after patient. But you know, in a bargain, sometimes, you know, we also forget that we also have to look after ourselves. Nursing is a challenging profession, and even a simple day stress is significant and needs to be dealt with, because they're always under great stress, because where life is involved, obviously the stress is equally important. But not all the stress is bad. The good kind of stress pushes us to save ourselves and others. The good stress keeps us motivated and alert on worse days. Even every living biological life form has its kind of stress that allows that life form to go on and be productive. For a nurse, the list of stresses can be very, very long. I believe in order to cope with all these stresses we have in our lives, we have to be strong in mind, body, and spirit, as we just said, that we have to nurture ourselves every single day. You know, do find your balance physically, mentally, and spiritually. You are so busy taking care of other people, I think we do not take very good care of ourselves. So this is a lesson that we should all be taking. Another part of our life of the nurses that we have to keep in balance is our mental selves. I think we all need to nudge or take time every day for mental rest, as we live in a very chaotic world. When you find your balance, you rejuvenate your life spiritually. Our lives do get way out of balance when we are always juggling balls of responsibility, because you have so many things you know, to juggle around day in and day out. You know what Mother Teresa said, that it is, she said that I cannot do great things, but I can do only small things with a great love. And that's what most nurses do, that they do things with a lot of love and a lot of passion. Caregivers do more than any other group on the earth to truly ease the suffering of the world. For every hand you have held, for every paper you have pushed, for every life you have touched, for every candle you have lit, we thank you. We thank you, nursing officers. While you might think your part is small and ordinary, you are helping to make an extraordinary difference in this world. You, dear colleagues, are our true heroes, the warriors in a true sense. I appreciate all of those who have designed this program and the faculty who's arranging it, executing it. You are all so accomplished and able. You know, nurses are so much abled and so much accomplished. This is only a value addition. This 3-day training is just value adding it and you know, enriching you further. Wishing you all the very best in all your endeavors. And again, appreciate Dr. K.K. Aggarwal, Dr. K.K. Kalada, Manju Chugani, and you know, some of the other dear colleagues which I'm seeing here on the you know, on the webinar here, on the video conferencing, for all their help and all their, you know, their solidarity with the program. I'm very sure this will prove to be a milestone in the nursing care in times to come. Thank you very much.
Thank you, Professor Mahesh Verma. What a better way to thank the noble profession. Nurses yet are very important They play very important role for the upliftment of the